The member for Oshawa.
Thank you very much, Madam Speaker, and I am glad to be able to weigh in on behalf of the folks in Oshawa and broadly across Durham Region on Bill 175, which is entitled the Connecting People to Home and Community Care Act 2020. Speaker, this is an issue that, as we've heard around this room, is very close to home and is actually, indeed, in the home across all of our communities. So whether you're in Oshawa or Europe, North, Sudbury, anywhere, everyone should be able to access the care that they need in the way that they deserve, in the way that is best for them. And certainly, if it's our elderly community members and keeping them in their homes, that if that's a viable option instead of long-term care, all of these things should fit. We all recognize that. But unfortunately, in this bill, it's an enabling piece of legislation, and it leaves out much of the substance. We don't see in statute, we don't see in this legislation what we would want to see. In fact, we're facing the "just trust us, it'll be in regulations." You know, and there was some comments earlier about, but the government has put out their intention and their statements. Everything will be left to regulation, and again, we have to cross our fingers, and that should not be the basis of good home care and health care. And Speaker, you know, we've heard it repeatedly that our home care system is broken. And I worry that this is a case of rearranging the deck chairs instead of actually looking at what could be and how we fix it for all of the people that I know matter to all of us across our communities. Speaker, I remember early on when I was first elected, so many moons ago, I met with a few PSWs who were very passionate. There was one gentleman, and not a home care PSW, but in long-term care, but he had talked about how the system had changed from when he first entered the field as a care professional, wanting to make that difference and really make those connections with people to ensure that they had the best care that they deserved, and then watching over the years the erosion of the system. Now, that was specifically long-term care, but again, this is the voice of a PSW who knew that he did not have the tools or the time to provide the care that was deserved by his residents. And I remember meeting with a PSW again early on from out in the community, and she was very concerned. She worked for one of these private contract companies, and she was concerned about some of the safety protocols and going from an outbreak area, you know, an outbreak situation in a retirement residence, then going to a private home to meet with an elderly senior, and she was not getting the support that she...
Member from Oshawa, there's a few side conversations going on the government side, and it's very difficult for me to hear the member from the official opposition, so I'm going to ask that if you're going to have the conversations, either bring your own volume down or step outside to the lounge to continue your conversations. Thank you. Back to the member for Oshawa.
Thank you very much, Speaker. I'll do my best to engage the members opposite a little bit better. So I happen to have some letters and some stories, so maybe I can capture their attention and maybe their imagination to make the province a better place. Okay, but what I was saying is this particular PSW, who was a community PSW, who was going out and providing that home care, was very concerned about the resources that she didn't have and the safety protocols that she wasn't getting from her private employer. And in the province of Ontario, she absolutely should have been. You know, the law is the law is the law. And the problem is the oversight is not the oversight is not the oversight. So the law can be whatever, but if we don't have that public accountability layer, if we don't have eyes on, then we're again in that situation of crossing our fingers and trusting that people will do the right thing, or that employers will not cut corners, or that they will not just do whatever it takes to ensure that they keep that contract. And I think that that's an important piece of this as well. So, Speaker, yesterday was kind of a challenging day. My grandmother is almost 99. She'll be 99 in 3 weeks. She's telling everyone she's 99. And it was a bit of a rough day. Unfortunately, she had quite a fall, and she lives in a retirement home, and had a fall, took a header, and the poor thing split her face open and had wonderful paramedics who were trying to reassure her that she did indeed need to go to the hospital, but she couldn't see how banged up she was. Anyway, she ended up going to the hospital and had quite an adventure there from 8:30 in the morning when it started to when we could leave the hospital at 8 o'clock. I would like to say that, you know, to the paramedics, to Matt and his team, who were wonderful with her and then came back and checked in on her, they were fantastic. Grandma was very pleased that they remembered her and that they came over to see her. But to everyone who attended Grandma, she had super care, and we were glad to have that. But from the whole process was very interesting to be a part of. Certainly the offload delays in the hospital, you know, the waiting and the waiting and the waiting. So Grandma said all of her care was great, but it was just so boring because, you know, the hours in between. But Speaker, while I was there, I had the opportunity to take a look around and to see all of the hallway beds, like, you know, the signs on the wall that said hallway 1, hallway 2, hallway 3, hallway 4. They kept going. Hallway 6 was in front of a desk. One of the hallway spaces, so instead of a room, was a little chair in between shelves. My grandmother was offload number 1, so it looked like offload NO.1. So I assured Grandma it wasn't actually offload no one, that she was not a no one. She was number 1. She wasn't buying it. But it was very interesting, Speaker, to see the police officers and the paramedics who have to wait while we have these overcrowding pressures and the offload pressures and the hallway medicine, that they're not out in the community able to do what is needed there, that they are also part of this waiting game, to see the stresses and the pressures. And I want to commend everyone that I saw yesterday. And the reason that I'm bringing this up is, you know, when we look to our healthcare system, we have to see that it all should fit together, right? So if we're going to create strong and supported home care to keep people safe and well in their homes, to keep them from long-term care, all of this has to fit, because yesterday at the hospital, with all of the pressures, a big part of that is because there aren't the beds that we need in the hospital, because those beds are taken up by and I say this with affection, this is not a comment on the folks who are in those beds, but there isn't a place for them to go. The alternate level of care beds are at, I would say, crisis levels, and I'll get more into that, but they're taking up those beds because there isn't the right place for them. And if that right place is at home, we need to ensure that it's strong care, not just reorganized admin, that we have the PSWs, that we have it's not just a, you know, 1-800 I'm unhappy, but what happens with those complaints? How do we strengthen the system? But back to the hospital in the hallway yesterday. Speaker, I overheard things I had no business overhearing, because that's part of the challenge, and I know we all recognize that hallway health care and hallway medicine is a problem. But I overheard things, private conversations with doctors and with nurses, and, you know, sort of details that are none of anyone's business but that the healthcare provider, but because we were all on top of each other in this hallway, you become privy and you become involved, or you become aware, and that's embarrassing for folks, and it's very challenging. The beeping and the alarms, the sounds, the lights, the colors, the noise. You know, where Grandma was, she was in the hallway right across from the pantry, and I will tell you, that little kitchen was a busy spot. Everybody needed a glass of water, and, you know, was coming and going constantly. But seeing it firsthand, I know we all talk about it and we hear from folks the indignities and the challenges, but to really watch it unfold, we do have to address it, and this bill is not sufficient. We have to piece this all together. So, Speaker, I got to see the reality and feel the pain of being sick in public, you know, but Grandma had me to help her with the washroom and to pull up her blankets and to explain while we were waiting and waiting. I helped other people pull up their blankets because they were, you know, partly exposed in the hallway and they were cold and things were coming and going. That while they were doing Grandma's stitches, we had to tuck in because there was a stretcher, and the cart that did the blood work had to tuck in when there was a stretcher, and it was just so, I'll say, chaotic. And I don't mean to be rude to the folks at the hospital, because, man, were they doing an awesome job under the conditions. I want to thank Brad, who was Grandma's nurse, and I want to personally thank Gabrielle, who's a physician's assistant, and she took as long as it needed to take to stitch up my grandma's mouth after her horrible fall, so she will still have her little wicked grandma grin, and even all banged up and the worse for wear. She gave a wink and a repaired grin to one of the paramedics who apologized that she couldn't have a room, and she said, "It isn't your fault, it's the Premier's. He's cutting health care, so here we are." She didn't get that from me. Oh yeah, Grandma's 99 and Grandma's seen a lot of things, and she believes that everyone has access to health care and should have access to health care. But Grandma also lives in a building with a number of seniors who do have home care. That they have care coordinators who send in the care that they need, and they all have opinions on what they deserve and need. But it's a challenge. It's a challenge to have that continuity of care and someone new every time to come and bathe you and you know, to build that trust with. And we ask a lot of our community members who do rely on home care when we don't provide that continuity, when we don't give them access to that dignity, when they can't depend on the scheduling and everything. And when we talk about, when we're looking at this bill, again, as we have heard, this bill paints a picture of making everything better, but we don't see the how. So those regulations, I learned from the last government, I'm learning from this one, I don't trust that those regulations are going to be what they need. Start putting things into legislation, put things in statute so that we can take it to the bank, frankly. But Speaker, something else in the Lakeridge Health family and in our neck of the woods, I know we see it across the province, is alternate levels of care, the ALC beds. And the Lakeridge Health ALC rates are shocking, and that is when patients are using acute care beds that are hospital beds because there isn't the right place for them to go, whether it's rehab, whether it's long-term care, most are long-term care. Across the province, my understanding is about between 50 and 60% are waiting for long-term care. It's about 50 beds that is getting into dangerous territory, or so I've been told, but in Oshawa, or in Lakeridge, we're at about 250 ALC beds. And I've been told that we can safely cover 100. Anything above 50 is dangerous. So Scarborough, for example, has 100 ALC beds. Lakeridge Health has 250. And what that means is that there isn't the space for others, that we don't have the long-term care. We have to get home care right. We have to get long-term care right. We have to get that started, for crying out loud. We really have to build that system that supports people so they can get the care that they deserve. And Speaker, one of the strategies that Lakeridge Health is employing or is working on to take some of the pressure off are transitional care beds in the community. They're seeking to have about 100 transitional care beds in the community, and those are the ALC long-term care transitional beds that would be operating in private retirement residences across Durham Region. This is an interesting concept, Speaker, and I'm, again, familiar with it because, you know, my grandma helps me learn a lot. But where she is living, it's one of the pilot projects, basically, for these transitional care beds, and a whole floor in the private retirement residence is being rented, for lack of a better word, or rented by the hospital at a reduced rate in the private retirement home. So the hospitals are getting these big blocks of rooms. The home gets to do the screening, and then the folks who are, whatever the criteria are, maybe qualified enough or independent enough to be able to move from the hospital ALC beds into these transitional care beds. And then, so the hospital's paying room and board, and then the hospital is also paying for the care from these private care companies, that they go in with their PSWs and hopefully provide a level of care that you would want for your loved one. This is not a permanent solution. This is a creative option because Lakeridge, as I said, they are desperate to provide the care to our community that they're qualified and capable of doing. But with all of those beds filled, they're trying to get creative. So this is one situation, and I have major concerns over this, but I also recognize the need to have people somewhere getting a level of care. But my office has been inundated with concerns from those in the transitional care beds as they're transitioning, because they haven't worked out all the kinks yet. So as we are trying to figure out who to call for complaints and who's actually responsible and who's on the hook and who regulates it, this is new uncharted territory. So we have been working that out with the hospitals. But what is it going to look like across the whole province when there's one phone line that is the complaint line? I don't have faith in them generally, but Speaker, in this bill, it amends the Private Hospitals Act and changes the definition of the private hospital to provide prescribed home and community care services that include residential accommodation. So, are these transitional care floors in private residences, are they now going to be considered private hospitals? I don't know. That is a legit question. So, they're residential, but it by no means is a hospital at all. Like, there's not a medical, no. They have PSWs coming in. There might be a doctor on call. I had heard that when they press their buttons, they're not getting the calls or the care that they need. Hopefully that's been worked out. So you're creating something without really backing it up, frankly. We've heard a lot about robust accountability. Well, we've got countless PSWs that are sharing stories about the challenges of their job, that they are leaving the field, that we're not retaining good workers. They don't have safe workplaces. They don't have the tools that they need. We're just crossing our fingers and trusting some of these, private contract companies without having that public oversight, and that is beyond worrisome. We should be erring on the side of health and on caution, not just giving free rein and saying, we know you'll be fine, go. But I don't think, we know that PSWs don't have the respect or the support often of their employers. They certainly don't seem to have the support and the respect of the last government. Lord knows, we watched them turn their backs on them constantly, and we're seeing that now, that the government talks about the importance of PSWs and yet isn't willing to compensate them fairly, isn't putting anything into this bill that would ensure that their workplaces are what they're asking for to be able to provide the appropriate level of care. And back to those complaint phone lines, the conversation before this, the member from Nickel Belt was asking, how will those complaints be handled? We know, because this is healthcare, this is a massive, anything to do with healthcare, you're going to have complaints, you're going to have concerns. So what will you do with them? Because if you're not keeping track or you're not learning from that, how on earth do we strengthen, improve, or catch a problem and nip it in the bud and be able to address it? You should invite more information to be able to do more with it. And certainly the question of who will handle the appeals. If this is an internal process where complaints end up with the private companies then disciplining their own quietly behind closed doors, no, that is not okay. That is not what the PSWs and care workers deserve, and certainly not, in my estimation, not going to address those problems that could become systemic very quickly. If this government is so intent on privatizing health care, it's disappointing to the average Ontarian who doesn't know yet how bad this could be. They're going to reach for that health care and it won't be there. We're already seeing it, but it is coming, and for them to say, no, we're not going to privatize, because they know that is a word that sets people kind of, vibrating. People do not want a privatized health care system. They look around the world and they know that what we had was something that they could trust, that their families could be well, that they could be safe and kept in good health. And so the fact that this government has their quiet eye on privatizing it and making sure that more fingers get their grubby little paws into the private money bucket. That is not what healthcare should look like. Our home care is broken. We hear heartbreaking stories on a regular basis. That will not stop. And those complaint lines have to be more than a complaint line. We have to invite input. We have to learn from it. We have to strengthen our healthcare system, our home care system. This bill is just top line. This is an announcement. This is not substantial legislation, and that is what we deserve in Ontario.